you're saying that, for a rapid test, we should have had the symptoms at least for 5 days, if not more. Will that then mean that there has to be a separate elaborate procedure and an SOP for when you can use these testing kits?
So that has already been made and been discussed in ICMR, that if you have an individual who has, let's say, in a hotspot, an influenza-like illness, he comes to you with fever, cough and cold, and you're not sure how long that has been there. The easiest thing that you can do is do a point of care rapid test. If it's positive, then you are certain that this is definitely COVID-19 that you're dealing with because of the recent history of fever and cough. Although this can also give you an idea of past infection. If it's negative and you still have a strong suspicion that this could be COVID-19, then you should also get an RT-PCR test done. The advantage is that you will therefore have a number of individuals whom you will get away without having to get an RT-PCR done. The RT-PCR result may take some time because it has to go to a specialized lab, and sometimes that is not possible in a field situation, where this antibody test, which is a point of care test, will be very, very useful.
And who will be responsible for deciding which one should be done, and if there should be a follow-up? Will it be left to the testing labs in the hospitals, or are the citizens the ones who will have to keep these things in mind, doctor? Because I'm just thinking from a suspected patient's point of view. Am I to know the difference and which test would be more suitable for me?
So there is a proper algorithm made by the ICMR as to when the test to be done and what should be done if it is positive, if it is negative, and how you follow this up. You could also do another thing, that if you don't have RT-PCR at a center, let's say we are going to a rural area where it's not possible to do an RT-PCR, you could do the first test and if you quarantine the person and repeat the test after a few days to see whether it has now become positive. And that will tell you whether this is a COVID influenza-like illness or a non-COVID influenza-like illness. So the test has to be looked at in how we can use it, because the advantage of the antibody test is you can do it with a drop of blood. You can do it in a situation which is in a rural area or a small town where getting a sample and sending it for RT-PCR may take a longer period of time. And the second advantage is that it immediately gives the result. But like I said, it's not a test which will be useful immediately. It will take some time to be positive. And the other important thing to remember is that this is an antibody test. So once the antibodies are formed in your body or in your blood, they will remain positive for quite some time. So if you were to repeat this test after, say, in an asymptomatic person after some time, he may be positive because of past infection. And that's why it has to go along with the clinical history.